everyone, welcome to Main TV. My name is Divine James and you're welcome to another fantastic time out where we have to talk about cholera. And to do justice to this topic, cholera is everywhere right now in Nigeria, and we have been trying to see how we can manage the situation so that everybody will be safe. And on this note, we decided to take a walk into Lagos State University Teaching Hospital, where we have our amazing doctor who will be doing justice to this topic, so that we get to know what we can do when we are faced with a situation like this, or when a member of our family or our friends is faced with a situation like this, so that you and I know what we can do to manage the situation in our homes, in our environment, and also in our community. So today we have an amazing doctor who will be talking to us about this. Do not forget to hit the subscribe button, follow us, comment, share if you like the topic, and get it rolling. Stay with us, we'll be right back. Welcome back. You are watching Main TV, and my name is Divine James. So we are going to meet our doctor right now, and he will be telling us everything that we need to know. Now, I love my people to do the introduction themselves so that they have the time to tell us everything that we need to know about them. So join me as we meet our amazing doctor.
Thank you, Divine. Yeah. My name is Dr. Adebayo Aderigbe. I work in LASUT, that's Lagos State University Teaching Hospital, a consultant physician and a public health specialist.
Consultant physician, I like that. Okay, doctor. Let's go straight into this problem that we have that has been trending for over a month right now, and we're looking at the ways that we can manage the situation to so that this disease doesn't spread beyond where it is right. So I'd like you to tell us what cholera is.
Well, cholera is bacterial infection uh, caused by organism that we refer to as Vibrio Cholerae. And as I always like to say, cholera is something that has been with us for a long time. Not something that is new. It's something we refer to as the reimagined disease because they always come. In fact, we in Nigeria we have annual incidences of cholera. It was here, it's here this year, it was there last year. We have those kind of patterns recurring year after year. So it's a disease that is caused by, like I said, Vibrio cholerae, and it's very fatal. It can be very fatal if left untreated. Cause so many mortality and morbidity.
What are the symptoms of cholera? Just in case I notice something strange or an unusual feeling in my body, how can I identify that this is cholera or this is malaria or this is headache or something?
Okay. Thank you for that question. Before I go into how to identify cholera, I think it's just good that we first discuss how you can get cholera in the first, because um, that is where it starts from. Someone needs to get cholera before the person will get it. And I think for cholera, mainly, it's what we refer to as a fecal disease. And what we mean by fecal disease is that it's transmitted from the human feces to the human person by way of congestion of food or water that has been contaminated with the organism, right? And this is a disease that usually follows a seasonal variation. It's usually seen during the rainy season, and it's a disease of that, call it a disease of hygiene, environmental disease. And why is that so? Because the only way you can have fecal disease is when invariably, the organism that is excreted in the human feces invariably gets into water bodies, and then when it gets into water bodies, unfortunately, if people consume those water or food prepared with contaminated water, then they can come down with cholera. And when somebody comes down with cholera, one of the first things you notice is almost certain that the person will have some, and the diarrhea is very rapid, fast, and the stool is very watery.
Okay.
It just looks like rice. When you're just passing something that looks like rice water. That's classical about cholera. In other instances, people can have some other forms of GI infections that may mimic cholera. Maybe food poisoning and all that. But one of the classic signs that we use to identify that cholera is, somebody that has that repeated diarrhea episodes, with rice water, look alike in the stool. And they may have vomiting. Usually comes with or without vomiting.
Oh,
So what I'm saying is that it doesn't mean that everybody that has cholera may vomit, but of course, some of them usually comes with vomiting. And then generalized body weakness, obviously, because once you're passing so much stool, and then you're also vomiting, and so then you are losing so much water, and then of course your body will become dehydrated, and then you become so weak. So you have generalized body weakness. This is some people have muscle cramps. Those are some of the classical symptoms.
can it be mistaken for another kind of disease or infection?
Well, there are very few GI diseases. What I mean GI, gastrointestinal diseases can manifest that kind of symptom. Like I said earlier, when I said it can mimic some other diseases like food poisoning. Actually, if you consume maybe food that is contaminated with other forms of infectious agents, yes, you could also have some irritation in the bowel. But it doesn't mean that anybody that goes to the toilet frequently cholera.
Cholera. Okay.
Right? Yes.
I wanted that part to be very clear.
Yeah, it doesn't mean that anybody that goes to the toilet
Must have
no,
cholera.
but usually the first suspicion, anytime we're in an outbreak season like we are now, right? Then of course the first suspicion will be that, oh, this person has cholera. But we don't make a diagnosis of cholera until we have taken a stool sample, we have taken it to the lab, and then we can identify the organism in the stool sample. But if somebody usually is passing so much stool, eating, dehydrated, and then gets to the hospital, of course, the first thing is to try to resuscitate the person, right? And rehydrated, so much water. If necessary, intravenous fluids are also given to the patient. And while we take the stool sample, there's something we call incubation period in epidemiology, and what I mean by that is, the time between when the organism gets into the human body and when the human starts manifesting symptoms. Now, in the case of cholera, the incubation period can be between 2 hours to 5 days. That is to say, if somebody consumes a food, in the last 2 hours that is contaminated with cholera, or drinks water that is contaminated with the organism, and the person within 2 hours can actually start, with these symptoms, showing symptoms, diarrhea, and all that. It could also be as long as 5 days. Naturally, everybody that, whether we're in cholera season or not, if somebody is stooling frequently, right, the tendency for us, especially in this part of the world as Nigeria, not to follow and take some medications. And like I always keep saying, people tell you, I'm going to take flagyl, so that some people are going to take tetracycline. So those are first measures that people usually try to do, just to see if they can stop, the stooling and the vomiting that they do. Unfortunately, with cholera, because the diarrhea is almost too frequent, eventually, if the person does not take as much fluid and water as possible as is losing, because what we try to do in management of cholera is that we try to replace the fluid that is being lost through vomiting and diarrhea. What we usually advise people is there's something we call the oral rehydration salt, ORS, right? It's available in pharmacies around. Advise people to start with that, mix ORS in liters of water, clean water, and start taking it. What ORS does is that it tries to replace the lost water and electrolytes. So as people pass those through frequent diarrhea or they vomit, they're not only losing water, they are also losing some electrolytes in the body. So what ORS tries to do is that it tries to replace some of the fluid that they have lost. So this is what we call temporary solution. And while they try to do that, it's also advisable that they should visit the hospital that is closest. And while we are saying that they need to visit the hospital, they can be properly assessed. The test can be conducted to know if it's truly cholera, and then they can aggressively treat the cholera. The first advice will be, once somebody suspects that he or she has cholera, and they are passing so much stool and they're vomiting so much, that if you get ORS.
When you were talking, you talked about how cholera, how people contact cholera from infected water. We have this belief that once we hit anything up, the bacteria that are there is going to die. So, but in the case of cholera, it's looking like it's quite different, because you can get it from contaminated food, and before a food will be prepared, it has to go through the heat process. So does it not somehow kill this bacteria?
All right, so that's a very, very lovely question. Yes, and truly there are some diseases or some organisms that can survive if our food is properly cooked and rightly eaten, or water is properly boiled as well. Cholera will die. Okay. And so it's also important to state that if food is properly cooked or water is thoroughly boiled, very little chances that the person, even if water is contaminated, That's the body population, the organism dies. And so what we usually see in outbreak situations like that is some people take food that is contaminated and not thoroughly boiled. And I'll give you an example. Um, Using this present outbreak in Lagos as one of the, even though we were not 100% sure that that was the cause, but we were able to isolate that some of the people that took some people that had cholera are taking the form of one drink that we refer to as yeah,
Okay.
the drink that called cola.
Yes.
Yeah, and then this tiger nut drink. This
Okay.
tiger
And
nut
all the
drink.
zobo them and
Yes,
so.
and
Okay.
if you recall, making tiger nut drinks and all that, just take water and then the ingredient for the tiger nut and it doesn't go through a properly boiled, process. Cholera is not one of such diseases that you can get even with boiling. So one of the preventive measures is that when you are taking food or water, thoroughly boiled, thoroughly cooked. Because the transmission of cholera, one of the problems we have with cholera is that Nigeria is one of the countries that has the highest open defecation index in the world. Everywhere you go, you see people, we don't have enough toilets, we don't have enough public toilets. And you see people just passing through everywhere you go. Unfortunately, during the rainy season, because there's so much water and there's so much flood, so running water just washes the stool, into any water body it sees, and then if people come in contact with that water, they take it without boiling, so they can come down.
Okay, wait. Let me quickly ask this question. Is it that um, the people who stool in open places, is it that they already have this bacteria in them, or it is after excretion that this organism now grows in the patient? Could it be that I have it and I passes it out, or after excretion the thing just grows like apple tree?
All right, thank you. So usually cholera is excreted in stool. So of course there are people that we call as carriers. They have cholera already. The way they can have it is like passage. So of course while it is passed in stool, that is where it goes.
Okay.
Then if that's true, if washed off into running water, rivers, all that. People that consume such food often really become down with cholera. Even when the running water washes off and comes in contact with things like leaves, plants, vegetables, and all that.
Okay.
Just imagine that running water is running through somewhere, it's getting through from leaves and plants and all that. And then you see all these people doing herbal medication. You just go plug those leaves, squeeze them, make it into all this agbo or whatever you call it, herbal concoction. And then they go around and then sell it for people to take it. Knowing that the water or the vegetables or the tree trunks that are used and be contaminated with cholera. So some of this is some of the reasons.
It sounds like using infected vegetable to treat cholera. Like I have cholera and I want to do the native.
Exactly, and that's why we always keep saying that. The general admonition to people is that if you get some of this, because our people believe so much about some of we always just advocate that they should ensure that the water that is used, right, is safe water. And, even if you must do some of those things, get your water, boil them, allow them to cool off, and then use it in the
It's not, again, a communicable disease. It's not like if I sneeze and then you have it.
All right, so it's an infectious disease, right? You can't get it through sneezing, but apart from getting it through the food and water that you're taking, there's also something we call person-to-person transmission. Okay. What that means is, imagine that someone that has cholera or someone who is a carrier used the toilet without properly washing his or her hand, then he just sees you and then gives you a handshake.
Oh.
And then you don't know you use that to handle something. So one of the things we always advocate is universal precaution so that anybody that uses it must, wash their hands thoroughly. And that's why we advocate that people that have toilets, especially public toilets, so you cannot say somebody use the toilet, don't wash up properly, opens the door handle, you are going in, use your hand and shake somebody, and then they just get. So, of course, the quantity of the organism may not be so much in that regard, but it is possible that someone can.
Yeah, and
Yeah,
if you don't, if just in case, I mean, you now put your hand in your mouth, you can
of
still.
course, you put it in your
Okay,
mouth, but
now
do that. So,
this is sounding very more serious than I thought. I mean, one cannot be too careful. So it's not about I live in a posh area and I don't live in a local area, so I cannot have it because I live in a posh area.
no.
But for what we are hearing now, a posh man can have it.
Anybody can have it. It's just
Anybody
that
can
it's
have
more
it.
common in areas of where
Mm-hmm.
hygiene is not so practiced, those social classes. Of course, people don't pay so much attention to some of these things that we say. Of course, in a posh area, for instance, you see that their drainage is sometimes well done. You go around it and just, most of them cook their meals in house. So, of course, so they are not really exposed to some of these things. It doesn't mean that they're excluded. They can have cholera. Even a posh person can be in traffic and just see it. I cannot drink. I want to have it, and then you can have it. I also give this popular example when I'm talking about cholera. Imagine that you are just at a bar, you want to have a drink, and you tell them, give me ice. So ice my drink. You know the source of the water that was iced? You don't really know. Right? So it's also important that this when we do prevention of cholera, we try to educate everyone. Right? For you cooking food, for food vendors that are cooking food and they know that people are going to come and eat, so that the water source is good, and pour the water. If they are doing vegetables, they, they thoroughly cook the vegetables and wash it very well, carrots and all that. If you are bar, holders, have bars, if you are icing water, ensure that the water you are icing is water that is safe.
So when we come back, we'll be talking about the vaccine, if there are any, and who should take this vaccine, and also how we can do community management and the role that the government has to play in this trendy disease that is everywhere. So don't go nowhere. We'll be right back.